The root canal is a tooth-related procedure needed when the inner pulp of teeth becomes infected or irritated. When undergoing a root canal, the pulp that is infected is eliminated, while the inside of a tooth gets cleaned and disinfected, and finally the tooth is put in a seal to keep infection from spreading to. The procedure can be quite simple and painless for patients. A large number of them have questions about what recovery can be like following an operation like a root canal. The following video will discuss what to expect throughout the process of healing following an extraction. Day 1, immediately after the procedure. Following a root canal, there is a tendency to feel the discomfort of swelling as well as minor bleeding. A dentist might recommend an over-the-counter pain medicine to ease any discomfort or pain. It's also essential to refrain from eating or drinking until the numbing effect from the anesthesia is gone to ensure that you don't accidentally bite the tongue or cheek. Also, you may be urged to stay clear of chewing in the region of your mouth where you had the root canal done. Days 2 to 3, managing discomfort. Following the procedure of a root canal, it is possible that you will experience an uncomfortable sensation or some sensitivity to the affected tooth as well as in the around it. This is common and will be gradually improved after your mouth has healed. As well as taking the prescription pain medications that your dentist prescribes, it is also possible to apply a cold compress to the cheeks outside to ease swelling and alleviate the pain. Avoiding eating soft and extremely cold or hot food could also ease discomfort in this phase. Days 4 to 7, healing and recovery. On the 4th day following an appointment for a root canal, are likely to begin noticing improvements in the symptoms. The swelling will decrease and any discomfort or sensitivity will begin to ease. You should continue taking care of your oral health during this period by gently cleaning and flossing your mouth and refraining from any tasks that may put pressure on the affected tooth. Your dentist might also suggest another appointment at this period to review your progress and make sure that the root canal procedure was successful. Weeks 2 to 4, full recovery. Most times, total recuperation of a tooth canal will take between 2 and 4 weeks. The tooth is expected to continue healing and any remaining pain or discomfort should slowly disappear. It's crucial to keep taking good care of your mouth and follow any instructions post-op that your dentist may give you in order to minimize any problems and to ensure the longevity of your root canal. Your dentist could also suggest another appointment in order to track the healing process and to ensure the healing of your tooth has occurred in a proper manner. Conclusion. Recovery of a root canal will be different from one person to the next. However, many patients enjoy effortless and easy recuperation. Following the directions of your dentist by practicing excellent oral hygiene as well as taking care of your health through the healing process, you'll be sure to have a positive recuperation and long-term viability of your root canal. If you're concerned or have any other unusual signs while healing, be aware of your dentist for advice as well as support. Keep in mind that an appointment for a root canal can be an extremely common and efficient method of preserving teeth that have been damaged and also restoring your oral health. So do not hesitate to seek treatment when you're in need of it.